Hey, Dr. Cameron here from Jafari Acupuncture Clinic. So this video is about teaching you the number one thing that you could be doing for your Bell's palsy recovery that most of your doctors or neurologists are not gonna teach you about. Now, if you're watching this, I'm assuming you or a loved one is dealing with Bell's palsy. When it comes to the standard treatment, it's pretty much the same for everybody at the beginning. You're going to go to your doctor, you get diagnosed, and then after that, they'll probably prescribe you some steroid medications to bring down that general inflammation. And after that, they pretty much say the same exact thing to everybody. And that is that you have to wait, just give it time, give it 3 to 6 months, and hopefully things are just going to start to get better and make a full recovery, but we don't know. Now, I don't know about you, but if I can't move half my face, if I can't close my eye at night, if I can't smile, if I'm not able to chew, waiting 3 to 6 months and hopefully trying to see if it goes back to normal seems incredibly passive. It's not something I want to do. I want to actively do something actually, and I don't want to just wait. So this is what I want to teach you about. That things that you can be doing from the very beginning. Yes, even when you start getting medicated with steroids, these are things that you can start doing then. And there are three main things. The first one of those is that you want to continue to reduce the inflammation. I know you're getting steroids for the inflammation to bring down that acute pain that comes with it, but there's a lot of people where even after their steroids, they still have so much pain in their cheeks, around the temples, in the back of the ear, even into the neck, and it's excruciating. And that's because there's still a lot of inflammation present. Okay, we need to calm that down because it's a fire, and if that fire keeps raging, it's going to keep damaging the nerve. Now, with the nerves, we need to start repairing the nerve fiber. That's number two. What happens here with Bell's palsy is that these nerve fibers start getting damaged. These nerve fibers are like electrical wires. They connect your brain to your muscle. And when these electrical wires get damaged, that communication breaks down and you're not able to do that efficiently. And in Bell's palsy's case, at the beginning, you can't do it at all. That's why the face is droopy, doesn't move at all. So we need to go in there and start promoting that process of healing with the nerve fibers. And it is for the ultimate purpose, number three, of restoring that communication. The body is incredibly resilient, okay? It's going to try and do all of these things on its own. It's going to reduce the inflammation. It's going to start repairing these nerve fibers. It's going to start restoring communication. It knows to do these things, right? But the success varies person to person on how well your body is able to do it. It's the same for everything, Some bodies do it better, some bodies don't do it as well. And it's because of the amount of damage that happens. If in your Bell's palsy, the nerve fibers get minimal damage, you're probably the type of person where within a few weeks to a month, you're going to rapidly regain movement and recover quickly, very quickly. Okay? If there's moderate to severe damage, these are the cases where we worry about because it can take up to 2-3 months to even see a little bit of movement in the face. Okay, and that's very frustrating because it takes you 3 months just to start wiggling your eyebrow or moving the corner of your mouth, and you're just wondering, is this gonna get better ever? Is it ever gonna go back to normal? Now, that's the thing the doctors don't talk about, is that all these things that your body is doing, that it's trying to do, that sometimes it's struggling to do, you can support that process, that you don't need to just wait and sit around for it to do its job. You can go in there and give it a helping hand. And there's a lot of different things to do there. But in our clinic, for example, we support that through our processes and treatments with acupuncture. It can help reduce the inflammation. We take care of the nerve damage, and we're trying to restore the communication. Okay? That's one way to do it. There are other ways to do it too. You can just search online different methods that are evidence-based and can be helpful. But now, these are things that you want to start doing immediately. So now when we talk about timing, how soon do you want to do these things? Bell's palsy is essentially a race against time. We do not want nerve damage to stay there long term. We don't want it to settle. We don't want to let it, this is a metaphor, but for it to turn into a scar, okay, where it lays its mark on the body. because the longer it stays there without recovering, the harder it gets to change. Okay? This is why they say those first couple months, especially like the first 3 months, are so crucial to recovery. If we can get your body along, moving, improving in those first couple months, you are much more likely to make a full recovery. Now, if you've had Bell's palsy for years or even like 8, 9 months and you're like, oh shoot, what do I do? You know, I've passed that window. You shouldn't despair or give up hope. Like I said, body is incredibly resilient. And I continue to be amazed to this day the types of improvements that people make with nerve damage years later, the types of gains that they make. You know, for example, not being able to do a full smile to finally being able to do a smile 5 years after their onset. These kind of situations can happen. Okay, I'm not saying it's the norm, but you just never know what the body needs, and sometimes all it needs is a little bit of a push from an outside hand to help it regain what it originally wanted to do. Okay, so I hope this video was helpful. If you're interested in learning more about our process and treatments, please scroll below on this page. If you want to take it to the next step and see specifically how this process would work for you, what you can expect from it, you can scroll down and book a free consult with us. What that is basically you sit down with one of our clinicians one-to-one in person or online, and you just tell your story, what's been going on, how your body's doing, and then that way the clinician can tell you what you can reasonably expect in terms of improvements for your type of Bell's palsy. Thank you again. Take care. Bye-bye.